Hello, and welcome to Make a Difference, the show about how volunteers are making a difference every day right here in Montgomery County. I'm your host, Sandy Smith. As we prepare for our season of thanks, we must recognize the food insecurities, even in one of the wealthiest counties in the nation. Yes, right here in Montgomery County. Our guests today are working to help alleviate this issue. Welcome our guests from Community Farm Share, Jennifer Freeman, Executive Director, and Hoang Edullantes, Operations Manager. Welcome, Jennifer and Hoang.
Thank you. Thank you so much for having us here.
Let's begin with Jennifer. What exactly is the Community Farm Share, and what is your purpose?
Great, thanks. Yeah, Community Farm Share, we started out of the pandemic. So we did get started towards the end of 2020, where we saw the really strong need for both meeting the needs and nutritional needs of a lot of families. As you mentioned, food security is a significant problem also in Montgomery County. So we looked at those two issues as food insecurity, but also we saw that there was a great need in among our local farm producer, local fresh produce, vegetable producers who also needed a source for making their businesses continue. So we
Right.
wanted to be able to make that balance of both supporting our local farmers, but also supporting food insecurity. And so out of that, once when the pandemic started to subside, what we realized is obviously this is really an ongoing issue. It's been an issue for a long time, food insecurity, but now it was just seen more, I think, more clearly by
Mhm.
many people that hadn't seen it before. And that it also really made the connection with the need to support our local farmers and then diving deeper into the issues of how to make a sustainable, resilient, equitable local food system, which also is a critical need in the county.
So, why local and small farms specifically?
Mhm. Yeah, so local farms, a lot of reasons. First of all, there's again coming out of the pandemic, we saw issues like the supply
Yeah.
chains. People saw that their grocery stores, didn't carry what they had. There's a lot of research now is coming out too, but just even I think intuitively, we know that when food is grown in supporting soil, so healthy regenerative, healthy soils, regenerative farming, organic practices, that food is healthier. So it really does have a
Right.
higher nutrient density in it than food that has been grown at thousands away miles farm and been picked early, so when it's not ripe, and then trucked across the county and loses a lot of that nutrient density. Plus those varieties often are even grown specifically that their purpose is to make it across the country, as opposed to here the purpose is to provide good tasting food that has high nutrient density. So there's a nutrition element, there's a supply chain element, and there's also the piece about climate change. So again, we're using industrial food system uses a lot of practices that are not carbon friendly. So whether it's the carbon footprint again of trucking the produce across or flying the produce across wherever it's coming from, but also in the large agricultural sectors that they're not using the regenerative soil practices, which actually sinks carbon into the soil and alleviates that issue as well. So there's those again. There's usually three-pronged factors of why the local farm is definitely critical to support too.
Well, and I've traveled abroad and the food tastes so different, in countries where they go to the market every day because the foods are fresh, and they don't have the pesticides and the chemicals that are foods that here in this country, when
Yeah,
you run to the grocery store, who knows how long it's been on the shelf.
yeah,
So
yeah,
you can really taste the difference as a
yeah.
consumer.
Yeah, and there's really almost a direct correlation between the flavor and the nutrient density of it. So it's kind of a gut feeling that if it tastes better, it's probably better for you. That's
Right.
probably true. And I also want to add that a lot of in fact, the majority of our program participants that we serve are recent immigrants. And so one of the challenges that we have come across is that many family families, when they were in their previous country, actually the fresh produce, the local market produce, was cheaper and more accessible
Mhm.
than the processed foods that there is now here in the US. So then when people came here, and it's called the SAD American diet, the standard American diet is the SAD American diet, which is a lot of processed food from this industrial food system, then that became more accessible and less expensive, leading to a significant change often in people's diets. So shifting from the healthier produce that they had before now to this, and then that of course then leads to much of the diet related chronic disease that really all residents in the country either face or at risk of.
Wow, absolutely. Okay, so I was looking through some of your information. What do you mean when you say food is medicine? Food is medicine.
Yeah, great. Thank you. Yeah. So this is a concept. It's not too new. I think it's been around. Well, it's been around for centuries when we think about what really why we eat what we eat. But it's become more popular in the last maybe 5 or 10 years. And specifically, I guess it was in 2021, there was a White House conference on nutrition, health, and nutrition, health, and the third one, but a White House conference on this topic where it brought a lot of attention to what is food as medicine. So there's kind of a standard pyramid. There's a food as medicine pyramid out there,
Mhm.
which describes at the top of the pyramid is medically tailored meals. The middle of the pyramid is produce prescriptions, and the base of the pyramid is access to nutrition through WIC and SNAP and other federal benefits. So what we mean by food as medicine is that, especially for as a way of treating diet-related chronic disease, and here we're including diabetes, heart disease, obesity, and hypertension primarily, and cholesterol too. That when people have access to those healthy, fresh produce items, that really does make a difference, and especially when it's regular access. So we actually had a program last year that we had the results from, where we had 40 food as medicine patients that we connect through the local clinics. And the results showed that after 24 weeks, we do weekly fresh produce bags. I should have explained
Okay.
that in the beginning. So weekly bags, that with the 24 weekly bag produce, that their A1C numbers, which is a measurement of diabetes levels, was significantly reduced in the program as well. So it really does, kind of prove that there's that benefit to the healthy and consistent, regular healthy access too, because some food as medicine programs might have a larger, like once a month access opportunity, whereas when it's weekly, it does make a significant difference. And I want to add too that part of the food as medicine program is in combination with a nutrition education piece of it. So the participants in the program have access to either, just I guess in different ways, to do nutrition education component. One is that we partnered also with Holy Cross, that has a Road to Health program where participants were able to have in-class sessions for 6 weeks. And in other food as medicine programs, we've also done it where the caseworkers or the community health workers who staff themselves from the clinic do monthly check-ins, almost like a one-on-one sessions with people to, again, really talk about not only just here's the food, but really how and why does this make a difference in terms of managing diet-related chronic disease or prevention. So there's always that piece to have a longer term effect as well. This year, what we did was we purchased the produce from about 12 different farmers throughout the county, and we aggregated that into one space. So rather than just buying, from a few CSA farms who have the ability, CSA is community supported agriculture, that have the
Mhm.
ability to put all the food, the produce that they're growing themselves into a bag, and then we had volunteers pick those up. But this year, we changed that model to do aggregation, meaning that we now purchase from a wide variety of farms different items, and we bring that into one space and create those bags. The idea for that was that on multiple levels, one, it helps with the food system, helps the farmers, and that's kind of another topic. But just sticking with the food as medicine piece, it helped us to be able to choose what was going into the bag so that we could make it both culturally relevant for the families that gave us feedback about what their most common and valued produce items were, and also just in terms of the nutrition element to it. Having said that, so although we did make a significant change and improvement about getting sort of better, more appropriate foods for people that they were looking for, but it still wasn't a free choice model. And so what we really wanted to do was we heard again from the community. We have a lot of community feedback sessions and discussions with people. And there's an interest to be able to go to the market and choose what they want, whether it's what their families like, what they have time to cook, what their kids like, what they, are used to, or maybe they want to try something new. But really that choice is really critical, both in terms of making sure that more fresh produce is getting into the families and homes, and then also to make sure that there's not food waste as well, right? So that's the idea for the mobile market. Is we would do a pilot program next year where we are already this year we partner with we have two programs. So there's a farm to school program, and there's also the food as medicine program that we talked about. But for both of those programs, we would look to locations that are having high needs, but also low access. So when maybe there aren't grocery stores nearby, or maybe there's food deserts, or maybe there's not a farmers markets nearby that would have that access. But we would be able then to bring that farmers, like a little farm stand, local market stand, to those communities, whether we would have it at a school for half a day or we would have it at a clinic for half a day, and have that open access for residents. Another benefit of having the market, besides having the free choice, is that we'd be able to reach more families, because we can we have the ability then to take accept SNAP and WIC benefits, which again further out, makes it possible to reach more people as opposed to just the limited number that we were able to fund through our grant funding that we get.
You mentioned that you need volunteers for these programs, obviously. Hoang, do these volunteers need any special training or special skills?
For the most part, no. So most of our volunteers are currently helping out with food delivery or with food packing. So we do
Okay.
food packing on Wednesday, and then people will have come deliver on either Wednesday evening or Thursday. So obviously you would preferably easier to have a vehicle to help with food delivery. But with packing, you can just come as you are. We'll train you right on the spot. You just need some gloves and enjoy being a little bit outdoor and like working with fresh vegetables and with people. And so our volunteer season is slowly wrapping up. We're only 3 weeks left in the main season. And so there would definitely be more opportunity coming next spring, especially as we are having more of this pharmacy program coming up, and there was just be more opportunity. We are also looking for a social media coordinator as well as a volunteer coordinator. If people are interested, please visit our website.
Well, that leads me right into it. If someone is interested in volunteering, how would they contact you? What is your website?
Our website is communityfarmshare.org. So communityfarmshare.org. And you can just email us at info@communityfarmshare.org and we'll respond to you right away. We're also active on social media, so Instagram and Facebook. Then you can connect with us on there as well.
Any other future plans for Community Farm Share?
Yeah, no, thank you. And thanks, Hoang. That was great overview for the volunteers. Yeah, volunteers are just really the heart of what we do too. It's been great because we ended up this year getting sort of a core group of people, and they just know what they're doing, and they're all just feeling like a team, which is fantastic. So we love our volunteers. Yeah, and there'll be more opportunities too, exactly in the future, especially with like Hoang said with the mobile market too. But yeah, other plans is I think there's just a real interest to keep continuing in whatever creative ways that we can find to support schools, nutrition education, nutrition for children, and then also the food as medicine is really a big passion as well. So those two items, and as we can connect with our partners, we love working with other organizations. So shout out to our partners that we had worked with this year. We worked with Hughes United Methodist Church in Wheaton, and we also worked with our clinic partners with Mobile Med and with Care for Your Health, and WUMCO in the Up County in Poolesville area was another community partner. And Holy Cross I mentioned before as well. So, and we've been really fortunate to have those great partnerships. So we love that as well. So yeah, the future is it unfolds. I mean, there's unfortunately the problem is that need is there. I think one of the challenges is we always talk about how can we work ourselves out of a job, which would be the goal. But until that's possible, as long as we can get as much fresh produce to families that are looking for what they need. It matters on such a degree of the social determinants of health, right? So if kids have access and are healthier, they can do better in school. If adults are not feeling the stress of food insecurity and the physical issues of food insecurity, then then that creates a better home life or work life too. So there's always that circle and that interconnectedness that I want to emphasize, because it's not just a feeding program kind of a thing. It's not that simple. It's really always the interlinkages between, and that's why the partnerships are so important too with the other organizations and making this all happen. So thank you for this.
I think your future is bright. We've been speaking with Jennifer Freeman and Hoang Edullantes from Community Farm Share. Thank you for speaking with us, and continued success with your work.
Thank you.
Yeah.
If you're interested in these or any other volunteer opportunities, please go to our website, montgomeryserves.org. I'm your host, Sandy Smith. As we prepare for Thanksgiving, please keep in mind that there are families out there right here in Montgomery County that are in need of food all year round. If you can give financially or with your time, please do so. Thank you for joining us, and let's be sure to make a difference.